kinds of challenges that vulnerable populations or vulnerable mothers and children and families experience are enormous. We need to hold ourselves accountable. Many of the young mothers we're serving, by the way, have gone through significant challenges in their own lives. It's not uncommon for them to have been abused or neglected themselves, to have developed problems with substance use, to be in abusive relationships with their boyfriends. So all of those factors can compromise their ability to protect the developing fetus and that young child. Nurses guide women about diet, substance use, identifying the emerging complications of pregnancy, working with primary care providers to make sure that those emerging problems are treated more promptly and reliably. There is a very close relationship between nurses and primary care providers in creating the kind of support that women need to have a healthy pregnancy. And they also work with other health and human service providers. They systematically link families with other sources of primary care and health care, depending on their needs, help with housing. So all of that is designed to create a cohesive system to support development early in life. Among the things that we've set out to measure early on is, does the program help women improve their diets or cut down on tobacco use, or does it improve the outcomes of pregnancy? And in all of those areas, the answer is yes. We've seen significant replicated effects, biochemically validated reductions in prenatal tobacco use. We've seen significant reductions in pregnancy-induced hypertension. Hypertension is, in part, it's a reflection of the levels of stress that women have to contend with in pregnancy. We've seen reductions in the rates of low birth weight in babies who are born into more vulnerable families. The program is known internationally as the program with the strongest evidence of any in the world that it prevents child abuse and neglect. The public health impacts of this are enormous and as yet not fully measured.